7. So I'm joined now by Helen Jones-Kelley, the Executive Director of the Montgomery County Alcohol, Drug Addiction, and Mental Health Services Board, to discuss Stigmas, a Reach for Recovery, a big fundraiser to benefit the Greater Dayton Mental Health Foundation is upcoming, and former U.S. Congressman and mental health advocate Patrick Kennedy has battled bipolar disease and has been outspoken about taking the stigma out of mental illness. And first, let's talk about stigmas. What are you talking about? What is this exactly?
Well, we're talking about people who hide from sharing the fact that they have mental illness. A mental illness is a disease. Substance abuse, they're diseases. And people are afraid to share that information for fear that they may be violated in some way by a loved one, by people who they've known for years, who basically turn against them just because of the disease.
Right. It really leads to discrimination in many levels, doesn't it?
It does. One of the saddest stories was a woman who came to me and told me about her son being diagnosed with mental illness, and they didn't want to tell their neighbors, even though the neighbors had known the child his entire life, for fear of people being unkind to him or them being put into jeopardy in their own neighborhood.
So what do you do to fight this stigma?
You fight it by letting people know information about the illness, the fact that it is an illness. It's no different than any other illness. I remember, in fact, I'm old enough to remember when we used to talk about cancer very, very quietly. We didn't even say the word. This is the same kind of situation where if we can provide information and talk about it openly, people will understand that it's an illness, there are needs for supports within the community, and there are ways in which people can recover.
Are we getting closer to a cure?
Well, cure is recovery allows people to be able to work and be able to take their place in society. Cure is a relative term when you talk about mental illness because people do relapse. It can be a lifelong illness, just like a number of the illnesses that people deal with on a daily basis. But people can be treated and they can go about their lives just in a normal way. All
right, I mentioned the fundraiser that's coming up with Mr. Kennedy, founder of One Mind for Research, an independent nonprofit that strives to orchestrate a campaign to understand brain disorders. And how difficult was it tough to get his services for this evening?
Well, it wasn't that hard to do at all because he is very open about the fact that he has grappled with bipolar disease. And he wants to raise the community dialogue on that issue so that people understand and are more accepting and are able to support their friends and neighbors.
He's going to be speaking at a luncheon. Tell us about that.
He is on May 1st at Sinclair. He's going to be here to talk about reducing stigma. That will be on May 1st at 11:45 a.m. Tickets are available for $60. So we hope people will certainly turn out in the community to learn more.
At Sinclair Community College, always a great place to learn more, and we'll certainly learn more about this stigma with bipolar disorders and various other mental illnesses. What can we do right now if we have somebody in the family that maybe has not gotten the treatment that they need? What can we do?
What we can do is be supportive. Encourage them to seek treatment and then be supportive when they do, because there are going to be times when they're going to go through some difficulties. It's important for family, loved ones to really be there as a support system and make sure that they understand that they are not alone, so that they stay connected to everything that's important to them and they go on about their lives.
And contact your organization for more information.
Absolutely.
You are a valuable resource to our community, and we thank you so much for sharing this topic, and good luck coming up May 1st with Mr. Kennedy.
Looking forward to that. Thank you.
We are too. Our time now, 8:51.